Women from throughout the country keep coming to Chicago. The reason? They want and need an abortion. Good Day to Paul's Lena Gebhardt has our report.
The overturning of Roe v. Wade in 2022 means abortions are more difficult to access in many American states.
Roe versus Wade, right, which was the Supreme Court decision that allowed, or should I say, secured abortion care access for people federally, right, was in many ways, and that was 1972. And ever since 1972, I will have to add, there has been a backlash against Roe v. Wade, right? So since 1972, there have been forces in the US that have been working actively to chip away at rights, particularly for women and birthing people, to have access to comprehensive reproductive health care.
Since the overturn, many women have traveled to Illinois for abortions because it's still legal here. Some neighboring states like Wisconsin, Iowa, Missouri, Kentucky, and Indiana have more restrictive abortion policies. But even in Illinois, access to abortion varies in different parts of the state.
So in Chicago, right, people can have access to abortion care as they did before, but in other places in the state, especially downstate where there's less, it's more rural, throughout the state where it's more rural, many rural areas still don't have the number of practitioners that they need, right? So even in a state like Illinois, you're going to have a situation where those who have less access to infrastructure, right, those especially in more rural places in the state and et cetera, are going to still have a harder time accessing this type of care, right? It is still kind of a spotty sort of thing, even in the state of Illinois. And then I'll say lastly, we have seen now that so many people are traveling to our state, right, to be able to access abortion care and other reproductive health care services, because this doesn't only impact abortion care, by the way, right? They want to come for things like contraception. They want to come for things like the morning after pill, like we've been seeing. They want to come for people that they perceive as having, induced miscarriage or something like this. So it's really having this outsized impact on our state, too, when people are coming here for services.
In response to the overturning of Roe v. Wade, providers such as Planned Parenthood Illinois have had to expand their services and programs to meet new demands. Julie Yule works for Planned Parenthood and is also a manager for a program called SAFE Project. SAFE is an acronym that stands for Securing Access for Everyone.
SAFE encompasses our strategic planning initiatives around the fall of Roe v. Wade, because it was something that we saw on the horizon coming for years prior to the decision actually getting to the Supreme Court. My role in project managing the SAFE initiatives was really around, there's a lot of data that went into it, looking at our 17 health centers around the state. What capacity did we have? How many patients could we possibly see in a given year? And then that illustrates the need to hire more staff. It illustrates the need to open new health centers in certain geographic areas. So for example, we opened our Waukegan Health Center, which is on the far north side of the state, really close to the Wisconsin border. And we've seen a huge influx of patients traveling to Waukegan from Wisconsin in order to access care. We also expanded procedural abortion services at our Champaign clinic, which is very close to the border with Indiana. So we see a lot of Indiana patients there, Ohio patients coming over. And we also just opened a new clinic in Carbondale, Illinois as well, which is way down in the southern tip of the state. And we've already seen, I want to say 90% of the abortion patients that have been seen at that clinic so far have been from other states other than Illinois. So it really just illustrates the need and how much of a key haven state Illinois is, and how much of a key provider PPIL is in the landscape now.
PPIL stands for Planned Parenthood of Illinois. It provides a full range of reproductive health services, including cancer screenings, STI screenings, vasectomies, birth control, and gender-affirming hormone therapy. The organization also provides education and age-appropriate sex ed to students. Abortion bans and restrictions across the nation have impacted Planned Parenthood Illinois directly. Ewell says that since the overturn of Roe v. Wade, the overall volume of out-of-state abortion patients has increased from 5 to 25%.
Abortion bans don't stop people from having and needing abortions. Like, people will always have and need abortions. Bans just make it more difficult to access.
Dr. Mary Bowman, a nurse practitioner in Chicago who performs abortions, shares their experience.
I was in the last semester of my undergraduate degree when I got pregnant. I was very early. I knew that I wanted to have an abortion. Accessing abortion in the state of Illinois and having an abortion myself really catalyzed my interest in becoming an abortion provider and offering that care to people without judgment and with a lot of support.
Dr. Bowman explains
there can be a million reasons to have an abortion. Maybe it was a wanted pregnancy, but you're in an abusive relationship. Maybe it was a wanted pregnancy, but you have, medical reasons why being pregnant is unsafe. Maybe it's a wanted pregnancy, but it was wanted 6 months ago and now you got evicted and like your life is changing, So all of the areas of our lives that are impacted by the political landscape, by inflation, by rising rents and the housing crisis, by unemployment, all of those things impact people's reproductive futures. Every single person that I've encountered needed an abortion because they told me they needed an abortion, and it wasn't for me to decide.
While Roe v. Wade has impacted women at both the national and local level, the Women's Center at DePaul serves as a safe space for students who need support, explains Professor Dr. Ann Russo.
The Women's Center absolutely supports women's reproductive, we have a reproductive justice kind of framework that says, everybody has a right to make decisions about whether they want to have children or not have children, that people should have access to health care.
But many in this country still oppose abortion.
We believe that every life matters. We believe that every life counts from womb to tomb.
Meanwhile, the abortion debate goes on in this country, a debate that is very difficult and emotional and may even have the potential to impact the upcoming presidential election. For Good Day DePaul, I'm Lena Gebhardt.